Good wishes to everyone. I'm Srishti and my topic is back muscles. These are our contents. Most body weight is anterior to the vertebral column, especially in obese people. For this reason, the many strong muscles attached to the spinous and transverse processes of vertebrae are necessary to support and move the vertebral column. Before looking at the muscles, let us see the skin and the fascia. Human being mostly lies on his back, therefore the skin and fascia on the back are adapted to sustain pressure of the body weight. Therefore the skin is thick and is fixed to the underlying fascia. Incisions. Identify the external occipital protuberance of the skull and draw a line in the midline from the protuberance to the spine of the last thoracic T12 vertebra. Make incision along this line. How to identify the T12th vertebra is that we have to feel the inferior angle of scapula, and at that level T7th vertebra will get, and from there we have to count till the T12th vertebra. From there we have to take an incision to the deltoid tuberosity on the humerus, which is present on the lateral surface about the middle of the arm. Make another incision along a horizontal line from the 7th cervical spine to the acromion process of the scapula. Reflect the skin flap laterally. The muscles are divided into two groups. The extrinsic includes superficial and intermediate, whereas intrinsic includes the deep. Now let us have a look on the extrinsic muscles. The first superficial muscle is the trapezius, which has the shape of a trapezoid and which covers the upper half of the back. It originates from the external occipital protuberance, superior nuchal line, the ligamentum nuchae, the C7 spinous process, and T1 to T12 spinous processes. Insertion. The trapezius has three fibers, upper, middle and lower. So the upper fibers are inserted into the posterior border of lateral 1/3 of clavicle. Middle fibers into the medial margin of the acromion process and upper lip of the crest of spine of the scapula. Lower fibers on the medial end of the spine. Latissimus dorsi. It covers a large area of the lower back and is overlapped by the trapezius. Origin. This is the only muscle which connects the pelvic girdle and vertebral column to upper limb. It possesses extensive origin and narrow insertion. It is also called a swimmer's muscle. Insertion. The latissimus dorsi is inserted in the lower thoracic and lumbar vertebra, that is from T7 to L5, as well as sacrum, the iliac crest, inferior angle of the scapula, as well as the lower foreribs. The muscle winds round the lower border of the teres major and forms the posterior fold of the axilla. The tendon is twisted upside down and is inserted into the floor of the intertubercular sulcus, which is present in between the greater and the lesser tubercle. The next muscle is the levator scapulae. Origin, transverse processes of C1 and C2 and posterior tubercles of the transverse processes of C3 and C4. It is inserted in the superior angle and upper part of the medial border up to triangular area of the scapula. Let us now see the two rhomboids, that is the minor and the major. Let us first see about the rhomboid minor. Origin at the spines of C7 and T1, as we can see here, and the lower part of ligamentum nuchae, which begins at the external occipital protuberance and comes down till the C7 spine, as we can see here. It is inserted in the base of the triangular area at the root of the spine of the scapula, as it is highlighted here. After the rhomboid minor, we have the rhomboid major muscle, which comes below the rhomboid minor. It originates from the spines of T2 to T5 vertebrae, and it gets inserted in the medial border of scapula below the root of the spine. As we can see here, below the spine we have the insertion of the rhomboid major, at the root of the spine we have the insertion of rhomboid minor, and above it we have the levator scapulae insertion. Intrinsic muscles. In the intrinsic muscles, first let us see the intermediate muscles. So in intermediate we have to know about two muscles. Those are the serratus posterior superior and the serratus posterior inferior. So this is the serratus posterior superior one, and this is the serratus posterior inferior muscle. As we know that the extrinsic muscles helps to control the limbs and help in the respiratory movements, the intrinsic muscles helps to control the vertebral column, as well as it helps to maintain the stability and posture of the back. Now we have the deep group of intrinsic muscles. Here we get to see two important muscles towards the neck. Those are splenius capitis and semispinalis capitis. This one here is the splenius capitis, and below that we get semispinalis capitis. The whole muscle above is the splenius capitis. Now we have the erector spinae muscles. In erector spinae muscles there are three groups, from lateral to medial. The lateral one is ilia costalis. The next one is longissimus thoracis, and the medial one is spiralis thoracis. They are called as erector spinae muscles because they connect the transverse processes to the spinous processes. Nerve supply of trapezius, spinal part of accessory nerve, branches from C. Blood supply, suprascapular artery and vein, superficial branch of the transverse cervical artery and accompanying veins, deep branch of transverse cervical artery and accompanying veins. Trapezius and levator scapulae do the elevation. Latissimus dorsi does the adduction, extension, medial rotation, etc. The rhomboid minor and the rhomboid major along with trapezius does the retraction of scapula. Triangle of auscultation is a small triangular interval bounded medially by the lateral border of the trapezius, laterally by the medial border of scapula, and inferiorly by the upper border of latissimus dorsi. The floor of the triangle is formed by the 6th and 7th rib and 6th intercostal space and the rhomboid major. This is the only part of the back which is not covered by big muscles. Respiratory sounds of the apex of lower lobe heard through a stethoscope are better heard over this triangle on each side. On the left side, the cardiac orifice of the stomach lies deep to the triangle, and in days before X-rays were discovered, the sounds of solid liquids were auscultated over this triangle to confirm the esophageal tumor. Then we have the lumbar triangle of Petit. The lumbar triangle of Petit lies at the lower part. It is another small triangle surrounded by muscles. It is bounded medially by the lateral border of latissimus dorsi, laterally by the posterior border of the external oblique muscles of the abdomen, and inferiorly by the iliac crest which forms the base. The occasional hernia at this site is called as lumbar hernia. Clinical anatomy. Back sprain. Injury when ligament or tissue is involved without getting fracture of bone. Back strain. Tearing of back muscle fibers. It is the most common cause of low back pain. As protective mechanism, the back muscles go into spasm after injury. Thank you for your valuable time.